Now let's go through teaching points to master the introduction to Mallory Weiss Tear. So what is Mallory Weiss Tear? Somebody may ask. Mallory Weiss Tear is something very simple. And what do I mean by something very simple? Mallory Weiss Tear is a longitudinal, not a horizontal, longitudinal from top to down or down to up, mucosal laceration. And it usually happens in the distal esophagus. That is the lower part of the esophagus, the distal 1/3, or the upper part of the stomach. That's Mallory Weiss for you. Now, typically, it is associated with forceful, prolonged vomiting. Forceful, prolonged vomiting. And the reason why it's associated with that, and Dr. Margaret, you just written something in the comment section, bulimia, is because at times some of these patients, after they have, heavy meal, like they then force themselves to vomit, right? That's why they can develop that Mallory Weiss there. Now, where is the source of bleeding in Mallory Weiss Tear? As I said, the difference between Mallory Weiss Tear and Bohav's is that Bohav's is transmural, goes from the mucosa to the outside. Mallory Weiss is only the submucosa. Okay, so that is where the problem comes from, and that is one thing you can use to differentiate between Bohav's and Mallory Weiss. What one condition must be differentiated from Mallory Weiss? We've already answered that, but because I want to emphasize that point, it's Bohav's. So unlike Bohav's, which involves full thickness esophageal wrap, and Bohav's is also, associated with upper GI bleed. Mallory Weiss is also associated with some upper GI, but usually the Mallory Weiss upper GI bleed is very minimal. So as soon as you learn about Mallory Weiss, also don't forget to learn about Bohav's, because they go together and you must learn how to differentiate between them, right? Now, what are the risk factors? What are the risk factors of Mallory Weiss? Number one, alcohol use. You realize that alcohol use can be seen in about 40 to 80% of cases of patients who present with Mallory Weiss. Number two, hiatal hernias. Hiatal hernias. It may predispose to tears due to, the different pressure gradients, but then the evidence is not united, right? But we've seen in some literature that there is a relation between hiatal hernia and Mallory Weiss. Number three, age. But you realize that most of the patients who present with Mallory Weiss, they are usually under the age of 40 years. Under the age of 40 years. Other risk factors, because a lot of people talk about vomiting. But vomiting is one, that is forceful vomiting. There can also be coughing. Another one, seizures. So, if I'm a tough examiner, that is one thing I'll be examining you on. I may not say that the patient vomited. What I'll rather say is that maybe the patient had a seizure, and after that, the patient noted some blood in some blood, in the mouth and in the dress. He did not bleed from any other place. The patient is hemodynamically stable. So that's another thing. Another one can be abdominal injury, maybe a forceful abdominal injury forcing the patient to vomit, right? And certain medical procedures like passing an NG tube. So today, you sleep, you wake up, Dr. Emmanuel Akano, or Dr. Maria, or Dr. Jakilu, and Dr. Bruni appears in your dream. Please, tell me the risk factors for Mallory Weiss Tear. You should be able to tell me. Now, what's the mechanism? And aggravating conditions of Mallory Weiss Tear? Increased intra-abdominal pressure from vomiting or retching causes the mucosal tears, right? So can you imagine, look at the stomach. The stomach is bigger, the esophagus is tiny. Now you have all the contents of the stomach wanting to force themselves out through the esophagus one time. It can lead to, there can be a laceration, and that can happen. Now, if the patient has hiatal hernia and esophageal varices, these two can worsen the bleeding. So we have to know the risk factors, and you have to know the things which can worsen the bleeding in a patient with Mallory Weiss Tear. Hiatal hernia, esophageal. How will a patient with Mallory Weiss Tear present? Simple. Most of the time, hematemesis after a period of vomiting or retching, that kind of thing. And how are you going to make a definitive diagnosis of Mallory Weiss Tear? Endoscopy. It confirms the presence of mucosal laceration. Endoscopy. Okay? We use endoscopy to do that. Just straight to the point. We are not going to go around left or right. Now, how will a patient with Mallory Weiss Tear be treated? Treatment usually focuses on supportive care, some endoscopic interventions, and addressing underlying causes like alcohol use. So that is how you want to deal with that. And this is just